Have you ever finished using the bathroom, only to feel like you could go again a few minutes later? Or perhaps you've started planning long trips around where the nearest restroom is. Maybe you've even caught yourself wondering, is this just what happens after 60? The truth is, your bladder often gives you subtle warning signs long before a problem seriously affects your daily life. Many men ignore these changes because they happen so gradually. But understanding what your body may be trying to tell you can help you recognize when it's time to have a conversation with your healthcare provider. Today, we'll discuss 7 early signs that your bladder may be working harder than it should and why they're worth paying attention to. Hello, I'm Dr. Natalie, and welcome to Men's Health Today. Here we share evidence-based health information created specifically for men over 50. Helping you make informed decisions that support healthy aging and long-term wellness. If that's something you're interested in, consider subscribing so you don't miss future videos. Before we begin, I'd like to remind you that this video is intended for educational and informational purposes only. It should not be considered medical advice, and it is not a substitute for professional diagnosis or treatment. Bladder symptoms can have many different causes, so if you're experiencing persistent or worsening urinary problems, please consult your physician or another qualified healthcare professional. Now, let's begin. Meet David. David is 71 years old. For years, he considered himself healthy. He stayed active, enjoyed spending time with our children, rarely thought about his bladder. Then something started changing. At first, he noticed he was visiting the floor more often than usual. It wasn't painful, just more frequent. Over the following months, he found himself avoiding long walks because he worried about needing a restroom. He even started sitting near the aisle whenever he went to the movies. His family noticed the changes before he did. One afternoon, his daughter simply asked, "Dad, are you okay? You seem to be using the bathroom a lot lately." That simple question encouraged him to speak with his doctor. What David learned surprised him. His symptoms weren't caused by one single problem. Instead, they were part of a bigger picture that deserved proper evaluation. David's experience is more common than many people realize. The bladder and urinary system naturally change with age, but that doesn't mean every symptom should simply be accepted as normal. Let's begin with the first warning sign. Sign 1, you're visiting the bathroom more often than before. Think back 5 years. Has the number of times you use the bathroom during the day changed? Maybe you used to go every few hours. Now it seems like you're making trips much more often. Occasionally drinking more water or coffee can certainly increase bathroom visits. But when frequent urination becomes a regular pattern without an obvious explanation, it's worth paying attention to. Several different conditions can contribute to frequent urination, including bladder changes, an enlarged prostate, diabetes, certain medications, urinary tract infections, and other medical conditions. How often is too often? There's no single number that's considered normal for everyone. Fluid intake, medications, weather, and individual health all play a role. What's more important is noticing a clear change from what's normal for you. One thing healthcare professionals often notice is that many men don't realize how much their bathroom habits have changed until someone close to them points it out. Gradual changes are easy to overlook because they become part of everyday life. But here's something that surprises many men. The next warning sign isn't about how often you go. It's about what happens after you get there. Sign 2, you feel like your bladder never completely empties. Have you ever finished using the bathroom only to feel like there's still urine left? Maybe you stand there for a few extra seconds, hoping a little more will come out. Or perhaps you leave the bathroom and, just a few minutes later, feel like you need to go again. That lingering sensation of incomplete emptying is something many men experience, especially as they get older. It doesn't necessarily mean your bladder is actually full. Rather, it may be a sign that your bladder isn't emptying as efficiently as it once did. Several different conditions can contribute to this feeling, including bladder muscle changes, an enlarged prostate, certain neurological conditions, and other urinary tract problems. Can drinking less water solve this problem? Not usually. Reducing your fluid intake might temporarily reduce the number of bathroom trips, but it doesn't address the underlying cause of persistent urinary symptoms. If this feeling continues or becomes more frequent, it's worth discussing with your healthcare provider. Many healthcare professionals hear men describe this symptom in different ways. Some say it never feels finished. Others simply say something doesn't feel right. Whatever word someone uses, persistent changes like these deserve attention rather than being dismissed as normal aging. For some men, the next warning sign is even more frustrating because it doesn't just affect daytime activities. It interrupts something your body depends on every single night. Sleep. RC3, you're waking up more than once every night. Let me ask you a quick question. How many times did you wake up to use the bathroom last night? If the answer is once, that may not be unusual. But if it's becoming 2, 3, or even 4 times every night, it can begin affecting much more than your bladder. Interrupted sleep may leave you feeling tired during the day, reduce concentration, affect your mood, and make everyday activities feel more exhausting. Frequent nighttime urination, also known as nocturia, can have several possible causes. These include bladder changes, prostate enlargement, diabetes, sleep disorders, certain medications, and drinking large amounts of fluids before bedtime. Is waking up at night always caused by the bladder? No. Sometimes the bladder is only part of the picture. Other medical conditions, sleep issues, or even certain medications may also contribute to nighttime urination. That's why looking at your overall health, not just one symptom, is so important. But here's what many men don't expect. The next warning sign often appears during the day, and it can catch you completely off guard. Sign for the sudden urge to find a bathroom. Imagine you're shopping, driving, or simply talking with a friend. Then suddenly, you feel like you need a bathroom immediately. Not in 5 minutes, not after finishing your conversation. Right now, this sudden, intense urge to urinate is known as urinary urgency. It can happen unexpectedly and sometimes leaves very little time to reach a restroom. Urgency doesn't always mean there's a serious medical problem. However, when it becomes frequent or begins affecting your confidence and daily routine, it's worth mentioning during your next medical appointment. One thing healthcare professionals often notice is that urgency rarely appears completely out of nowhere. When men look back, many realize they had been experiencing smaller urinary changes for months before urgency became noticeable. Recognizing those earlier changes may help you understand your symptoms more clearly when speaking with your healthcare provider. Before we continue, the next warning sign is one that many men don't even think is related to their bladder. Some simply assume that's just part of getting older, but it may actually be your body's way of telling you that something has changed. So stay with me, because the final 3 warning signs are the ones men most often overlook. Sign 5, your urine stream isn't as strong as it used to be. Think back 10 years. Has your urine stream changed? Maybe it seems weaker, slower, or it simply takes longer to finish. Many men assume this is just another part of getting older. While aging can bring changes to the urinary system, a weaker stream may also be associated with several medical conditions, including an enlarged prostate, bladder function changes, certain medications, or other urinary tract problems. Because the change usually happens gradually, many men don't notice it until someone asks them about it. Does a weak urine stream always mean something serious? No, not necessarily. Some changes may have relatively simple explanations, while others deserve further evaluation. The important thing isn't trying to guess the cause. It's recognizing when a persistent change should be discussed with your healthcare provider. One thing healthcare professionals often observe is that men tend to compare today's symptoms with yesterday. But bladder and urinary changes usually happen over years, not days. Comparing how you feel today with 5 or even 10 years ago often gives a much clearer picture. Now let's look at another warning sign. One that's often frustrating because it happens after you think everything is finished. Sign 6, dribbling after urination. Imagine you've finished using the bathroom. You wash your hands, walk away. Then, you notice a few drops of urine afterwards. This is known as post-void dribbling, and it's more common than many men realize. Although it may seem like a small inconvenience, it can become frustrating over time and may affect confidence in everyday situations. Like the other symptoms we've discussed today, post-void dribbling doesn't point to one specific condition. It can have several different causes, which is why it's important to consider it alongside any other urinary symptoms you may be experiencing. Is this simply a normal part of aging? Growing older can bring changes to the urinary system, but that doesn't mean every symptom should automatically be dismissed as normal aging. Persistent or bothersome symptoms deserve a proper medical evaluation to better understand their cause. We've reached our final warning sign, and interestingly, it's one that many men never connect to bladder health at all. Sign 7, you start planning your day around bathrooms. Our final warning sign isn't really about the bladder itself. It's about how bladder symptoms begin affecting your everyday life. Maybe you avoid long car rides. Perhaps you sit near the restroom whenever you go out. Or you've started limiting social activities because you're worried about finding a bathroom in time. When urinary symptoms begin changing the way you live your life, that's an important signal that they deserve attention. The goal isn't to assume the worst. It's to recognize that your quality of life matters. One thing healthcare professionals often emphasize is that bladder symptoms aren't measured only by medical tests. They're also measured by how much they interfere with your daily activities, sleep, confidence, and overall well-being. That's why even symptoms that seem minor can still be important to discuss if they're affecting your life. So, what are the biggest lessons you should remember from today's discussion? Before we finish, let's quickly review the 7 early warning signs we discussed today. You're visiting the bathroom more often than before. You feel like your bladder never completely empties. You're waking up several times during the night. You experience sudden urinary urgency. Your urine stream isn't as strong as it used to be. You notice dribbling after urination. Your daily routine is starting to revolve around finding a bathroom. Remember, experiencing one or even several of these symptoms does not automatically mean you have a serious bladder problem. Many different conditions can produce similar urinary symptoms, and only a proper medical evaluation can determine the underlying cause. The most important message is simply to notice changes that are new, persistent, or beginning to affect your everyday life. One thing many healthcare professionals wish more men understood is that bladder symptoms don't always begin dramatically. More often, they appear little by little. You make one extra trip to the bathroom. You wake up one extra time during the night. You start choosing the aisle seat without really thinking about why. Each change seems small on its own, but together, they can tell an important story. Recognizing those changes early doesn't mean assuming something is seriously wrong. It simply means paying attention to your health and knowing when it's appropriate to seek professional advice. Before we finish, here's something worth remembering. Your bladder works quietly every single day. Most of the time, you never even think about it. That's exactly how it's supposed to be. So when bladder symptoms begin changing how you sleep, how you travel, or how confidently you go about your day, it's your body's way of telling you that something has changed. Listening to those signals isn't about becoming worried. It's about becoming informed. If you only remember one thing from today's video, let it be this. Small changes that happen gradually are often the easiest to ignore, but they're also the ones most worth paying attention to. Understanding your body is one of the most important steps you can take toward protecting your long-term health. If you found today's video helpful, please consider giving it a thumbs up. And if you're new to Men's Health Today, I'd love to invite you to subscribe. Every week, we share evidence-based videos created specifically for men over 50, covering topics such as prostate health, sexual health, bladder health, heart health, testosterone, nutrition. Healthy aging. Our goal is simple: to help you better understand your health through practical, evidence-based information you can trust. Now I'd like to hear from you. Which of today's 7 warning signs surprised you the most? Or have you noticed changes in your bladder habits over the past few years that you once assumed were simply part of getting older? Share your thoughts in the comments below. Your experience may help someone else realize they're not alone. Thank you so much for watching. Take care of yourself, stay healthy, and I'll see you in the next video.